Hey, welcome to the Nitty Gritty of Real Estate podcast. Today we're talking about Medicare insurance. So let's get to it. Hey everyone, Tom Krieger here from the Tom J. Krieger team. Hey, I'm here with Rob Young of the Rob Young Insurance Agency. And Rob, I invited you here because I'm 66. What's very confusing for me is not real estate, it's Medicare insurance. So I want to provide something of value to all the people who follow our podcasts. So thank you for coming here, and let's kind of dig through Medicare insurance, what it is, some of the pitfalls, what's the difference between A, B, C, D, E, F, G, H, I, J, K, L, M, right? There's so many letters and stuff like that for people who are just getting into the Medicare, 64, 65, things they want to avoid doing, mistakes that could cost them money, time, efforts like that. Okay, so thanks for being here, Rob.
Sure, thanks, Tom. Thanks for having me.
All right, so let's talk about what is Medicare insurance exactly.
So, without getting in a compliance issue with the CMS,
Yep.
Medicare Part A is hospital coverage, and Part B is doctor coverage that is provided by the taxes that we've paid for years through Medicare.
Okay.
On your payroll, W-2s, whatever. Now, A comes for free, no cost. B comes for a total now that's now increased up to about $170 a month, but you get a lot for that. And that's to make sure that people, as they get retired, as they get older, as they get 65 and beyond, that they're not completely destitute by medical problems.
And that was Medicare Part B.
Yeah, A and B.
And B is what you pay for, A is what's free.
Yep.
Do you pay for B with a check, or do they take it out of your taxes?
You have a chance to pay for B on a coupon book,
Okay.
or out of Social Security, or out of your railroad pension, or an EFT through your bank.
Okay.
Those four things.
So if you're collecting Social Security, they'll take it out of the check that they give you, right?
Before you get it.
Kind of like taxes.
Because you pay them before you get it.
Okay.
No doubt about that.
Interesting. Very interesting. So there's A and there's B. What about the other?
So one of the misconceptions of Medicare in the United States is that they haven't kept it simple. Simple meaning you and I could just talk about it, and in 5 minutes you'd be up there writing down what I said and you'd get it.
Okay.
It's not that way. The issue is, and a lot of people don't realize it, but I do. Luckily, I'm going to benefit from it. Realistically, people that are either turning 65 within 3 months of that, or they're disabled on Social Security, those people need to now sign up for Medicare. And they need guidance because it's not a simple process. One of my clients most recently didn't think on a message that I had to him, didn't think actually to have me get together and help him sign up for A and B, thought he could just do it on own.
Uh-huh.
Well, he completed his A, he forgot to do B, and what he doesn't realize is without both A and B, he doesn't get to have any other insurance until Medicare or Social Security fixes it. He's still waiting, and it's been 2 months because he goofed it up, and I should have been helping him. I don't get paid for that, but I want to see a good outcome.
It's a nice service you provide.
Yeah.
Yeah, full service type of insurance agent.
Correct.
Yeah.
And then what leads on to that is a discussion of, hey, if you've got A and B, that's not going to cover all of the things that are going to happen during your lifetime and as you progress and get older. You got to usually typically have other insurance. Well, there's been other insurance that's been brought up in Medicare through CMS. That's the Center for Medicare Services in Washington, D.C.
Okay.
And what happens is they've lettered the different choices you can pick. And you hit it. Part C, okay? Part C is actually what's called Medicare Advantage plans, which are literally copay plans that usually include prescription drugs, and they can cost as little as zero. Most people don't understand that. They think everything always costs. I did too. But when I found out what zero meant, guess where zero comes from? It's paid for by our taxes.
Okay.
It's not a secret. Part D, prescription drug coverage. prescription drug coverage, when you turn 65 or leave your employment, it's really important, because most people don't get this, that if you don't have a credible Part D plan, insurance plan, when you leave employment or you depart from your spouse's insurance or whatever, if it's not credible, which is something we can discuss, then you get charged 10% per year for the rest of your life. I've seen people that that were supposed to pay about $30 a month on Medicare Part D. They were paying over $400 a month because they never paid attention.
Oh, wow.
They just didn't pay attention. That's Part D.
Wow.
Now you can imagine why they force us to get Part D, because prescription drugs in our country are really expensive, and they also don't want people as they get older to be having to pay all of their assets to prescription drug plan or for something at CVS pharmacy or whatever. They need people to stay a little bit solvent.
Okay.
Yeah.
Okay. So a credible Part D, what makes it credible?
It has to offer the plans, the actual formulary that CMS has that's mandatory for any Part D insurance.
Okay. So
which means they can't sit there and go, well, Tom, you've got a $30,000 a month prescription. We're not covering that. They've got to list it all in, and you've got to be able to also be open enough to accept that if you have a prescription that's not on there, we can actually send a form in writing and request to add it to their formulary.
Interesting.
Yeah,
very
that's
interesting.
Part D.
Okay.
Yeah.
All right. So we've got Part A, which is given to you by the government through your taxes. We have Part B, which you pay for either outright if you're not collecting Social Security, or it can come out of the Social Security check. You can pay that either through an EFT out of your bank, or again, they take it out of your check. You have Part C, which is like a supplemental, right?
Yeah,
Where
it's actually called a Medicare Advantage.
Medicare Advantage. So that'll cover some of the things that A doesn't cover, correct?
And B.
And B doesn't cover.
Yeah.
And then you have D, which is really prescription drugs.
Yeah.
And there are certain type of prescription drug type of coverages where you don't pay anything. That usually gets paid most of the time by your taxes to the government. Or you could have something where you supplement that payment.
Right.
Correct?
Yeah.
Okay.
Now, there is another thing to Part B. If you're still working and you want to sign up to have those benefits, it's okay. You can do that. But under a certain income threshold, you may be earning enough money to get above that threshold, which means you might be paying close to $500 a month for Part B.
Okay.
I know people that do that, and they're willing, they're going to stop it as soon as they stop working. Then they'll be back to the 170.
Okay.
Okay. And then wrapping up, Plan G is what's called Medigap plan. And Plan F is also a Medigap, but it's been kind of phased out. So I'll just go into Plan G. Plan G is a Medigap plan that basically costs roughly around $200 a month. It covers all of your medical costs, period. You'll never pay another dime except that premium. You have to have a Part D plan. That hasn't changed. You still got to have one of those. I've seen Part D plans vary from $8 a month to $35 a month in the last, 30 days or so. On Part G, only thing you have to realize is that you have to be able to afford to make that payment, and you also have to understand that because of Part G rules, they make you pay for your Part B premium, which you probably already are doing, but just in case you're not doing it, like you maybe have some kind of help or assistance, you're paying for your Part B premium if you have Part G.
Hey everyone, we want to interrupt this episode to let you know that we are a Keller Williams Southern Arizona franchise.
Also, we are licensed realtors practicing equal housing.
Now, let's get you back to the podcast.
And that's the only two. See, Medicare to me, after I've been in it for the last 15 years, has been pretty simple.
Mm-hmm.
But it's not simple from the very beginning that you're supposed to sign up and all the way through to the point where you're supposed to pick something that's going to work for you and then review it every year to make sure it still works for you the best.
So let's talk about that reviewing it every year. What does that look like?
So to lead into that, let's say I help you
do
Medicare during open enrollment which is October 15th through December 7th. Now, that's not a very long period of time, October 15th through December 7th, but I help you anyway. And what I also do is I follow up with you probably 2 weeks before the end of the year to make sure that you received your cards and stuff from the insurance company.
Okay.
I follow up probably end of January, first part of February, guess what? To find out how the plan's working. You know, it's not going to be worth anything if it's not working right.
Yeah, makes sense.
So it's a logical step. Now, there is one thing that the government did in D.C. a few years ago. They realized that 6 weeks or 7 weeks wasn't very much time. So what do people do typically in Medicare? They're not paying attention. So they gave them a 3-month period till March 31st where it's a annual enrollment period where you can change, if you have a Medicare Advantage plan, you can change it to another plan one time. So if you don't have a plan that's working, you can change it one time, but at least you got a shot.
Okay.
Okay. Now, after I talk to you in January, February, and go through that, I'll typically set up a time to do a review, usually around October 1st, because that's the first time we ever get released on the new plans for like 2023.
Okay.
And I call you somewhere around there and set up an appointment to review what you've got, make sure things are going okay, make sure that if there's anybody else I should be helping in your family, do whatever it takes. But I also make sure that the plan is going to work for you, because what if people's situation in health does? It changes.
Yeah.
You might be taking more prescriptions. You might have a plan that now you have a different doctor and we got to switch companies. Who knows? But we know it doesn't stay level.
So that's your yearly review and your follow-up like a good insurance agent does.
Right.
Okay. So what are the pitfalls that we need to look at?
So a couple that I can think of that are at the top. Realistically, the majority of the people out there should be helped from the day they go on and get login and ID on SSA.gov to sign up for Medicare.
Okay.
Because, you know, if they really want to be on A and B, then they need to not muck that up. Okay? That's one thing. I had a situation about 2 months ago where one of my clients who followed up and said, you know, I got a letter from the insurance company, Medicare, a Medicare plan. I got a letter from insurance company that said my plan was discontinued for me. Stopped. Well, he looks at it in shock. He goes to the doctor all the time. He takes prescriptions. He calls me up because I don't understand it. And I said, well, send me a picture of it. So I get it. And I still didn't understand. He goes, oh, Rob, you know what? I didn't tell you that I moved. If you move locations and change out of that zip code, Medicare insurance companies can drop you, but they'll usually give you 30 days. Well, he mucked that one up. So I said, oh, where do you live now? And he told me where he lived. He lived in Leavenworth, Washington. Okay. And I said, well, that's a beautiful place, but did you tell the insurance company? No. I said, well, that's why they dropped you. So now you better not have a big claim because you don't have insurance now. So we had to immediately sign him up for a new plan. He went on to a Medigap plan because that seemed to fit for him and a Part D. But luckily, when it went into place, he didn't have any insurance claims or have any health issues during that time when he got dropped.
Oh, good for him.
Those are a couple of pitfalls. You just have to be aware of it. You can make changes to your Medicare if you get married. You can change if you have a child. You can change if you move. You can change if you get divorced. You can change if you fall off the insurance from your work or your spouse's plan. There's a bunch of different things, or you become disabled, or you need assistance financially through state services, those kinds of things. A lot of those things you can use those to your advantage and not run into a pitfall and take advantage of the Medicare system.
Wow, Rob, that's a lot of information.
It is.
You know, you are a wealth of information. And if some of our listeners want to get in touch with you, what's the best way for them to reach out to get a hold of Rob Young?
The best way is my phone is the easiest.
Okay.
It's 206-234-6797. I get texts first, phone calls also good. And then if you really want to reach me by email and you have data to give me or something, send it to robyounginsurance@gmail.com.
Wow, great, Rob. Hey, I want to thank you for coming in. I want everybody to understand we're going to have Rob here on a regular basis. About every 12, 13, 14 weeks, he's going to come in and just give us some update on Medicare, Medicaid. And until next time, have a great day, everyone.
Hey, thank you for listening and watching the Nitty Gritty podcast here with the Tom J. Krieger team. If you are thinking about buying a home, selling a home, or even investing in real estate, please reach out to us. We are local here in Tucson, Arizona, but we are also connected to over 4,000 agents across the US. So again, looking to buy, sell, or invest in your hometown, reach out to us and let us connect you.